for yes so emamo akwaba kese pa ba Royal Health Talk Show so ane say munim no memini de bia ni hia bon komo fa ya po mu den ho nyame adom ende so memini da ye hia ye baba be bon komo fa ya po mu den ho sese na munim na adwumakuo bi na akwa afa dwuma die ho ka ane City Gold Jewelries wo Makola Shopping Mall and Royal Natural Health and Wellness Clinic and Royal Natural Health and Wellness Clinic says in America we are known for fertility. Tinkofo Pinafe say won edwuma nko an ye nso no enya won nko an ye we do several things even in this month of October no we are running series of tests and there breast cancer screening awareness our clinic and it was so interesting ni say every member dey be after Joada kopem Fidano ye kasa ye bode ru ewo TV show a home based TV show ye ba be bode ru ewo so nurses no any workers at home based Royal Natural Health and Wellness Clinic ye ba home based TV in the course of the week no morning show no we try to educate the general public na memini da no ye breast screening no ni twa breast cancer so mo se bibia e touch man na say hu be hia so be to eduro ana say hu be hia so be bibia na ye den etu efo ana say ya ma we hu na we tu ho anamo. And we started some series of conversations over the past weeks. We've been talking about fertility, infections, and other related issues. And we are Natural Health and Wellness Clinic. When we are doing things like this now, what we are trying to tell our viewers is, share tia bibi wom now ba. That's bibi only doctor ne bon komo. Doctor bi obetum bi only ne bon komo no. Se nkomo bi aye boy and as bi mpo aye boy so TV so no. Se kana se fa we are no ho a oba yenyamre ehwo yenyamre ehun dia ehun hia se o se yema. One thing people like Royal Natural Health and Wellness Clinic is about, especially when it comes to the health show, they say we listen to our patients' concern. Patients need common problems na yitie ni afemu aba na ya hwe so ni de hu de betumi aden ya ye ama the patient no and there you bet you are in common. So last week we did a recording with Dr. Clement Dapalon. We spoke length at things and then ye baba be in some bia obobo mu no ni abobo so ya fa some salient point maybe I can ya bia we received several messages that people would want further clarification. People want us to explain it more ni benya mena ya cheche ni nyinara mu ewi e be bia homato no so atum na so also be e che wadwanu aden wa friend na we be say and then no there ye ni Facebook but your YouTube in a sense wo Instagram internal and a sense wo is it X first normal friend no it's a social media friend X. We are on X and then is it Telegram or Twitter? Yeah, it was formerly Twitter. Yeah, as you see, and we are no more. It's not more Twitter now. It's called X. So we are on X. Call your friends. A Royal Health Talk Show. No, we've started. You can watch us on YouTube and then you can watch us on X. So who will fear there at the comfort of your home? No, just tune into home-based TV and then let us have a discussion. You better try your work and cry to Abayaba. You better share and then come on. I say that I say some come a new casual and bless or say, Doc, I see what you do on TV and I want to bless you with this dress. Yamisha Opa new casual. Is it Sakaman? Dansuman Sakaman. I think we'll project their number in the course of our discussion so that also so Atara Misha say offer wait to me a friend my woman GB ama also so. Yentra yon konkoji abwa fonka embrace.
If you or someone you know are shopping for jewelry and accessories for a wedding or any occasion, make it special. Make it City Gold. City Gold is the leading gold hub in Ghana that makes special moments memorable just for you. Do you need genuine gold jewelry and accessory like earrings, watches, necklaces, bracelets, rings, and so on and so forth for that special someone or occasion? Do you need assistance in choosing the best wedding and engagement rings? City Bridal, under the auspices of City Gold, has everything that will complement your desired wedding gown. We have in stock all you need for your weddings, bridal showers, traditional marriage ceremonies, accessories, and lots more. Remember, our jewelries are specially designed to meet your budget and your taste. For wholesale and retail, call us now at City Gold 0302 906 750 or 0208 150 679, or locate us in Accra at the Makola Shopping Mall, 5th Gojo Thompson Road, right here in Accra. City Gold, home of quality jewelry.
We are actually for essential at the Asida Kese Pama will say, when you're a mere not all sharing our Royal Health Talk Show. So, says in a kind before we went on break, last week we looked at some interesting discussion we had with Dr. Clement Dapalon. Yeah, Dr. Clement Dapalon is it's a visiting consultant at Obara Natural Health and Wellness Clinic, in terms of our fertility and then our infection treatment at our facility. The last month, we had conversations concerning that is about 3 weeks ago. We had a series of conversations concerning fertility, things pertaining to fertility, what causes infertility in women, what causes infertility even in men. In the process, we had a chance of having a chat with him as well, and then he had one or two things to say concerning infections. And then one of the major things that came into mind had to do with complications with infections. You got complications in terms of complicated or untreated sexually transmitted infections. What does it mean? Makano potoka semu interestingly. The Indian se bia uyoba anase bema na bia na in the line of growth anase wunyi mu na anase obo abrabo no nya oba kumienu bi enyo utwa ho kakra when treat one protect ho enti na akwakofa infection abra na ho so no bi one thing we mostly see when it comes to infection and so on the TV so yabon komo bebre yetaka say infections bi owa eba embo nkai mposi aba mostly nkofo bi owa infections krampo no munya infection to me wo omo ho a che until so omo white blood cells and say omo immune system na ye a bit weaker as ye omo ntumi nya hwe no eno na a beginning say manifesting to bi owa ye friend say bia na ye friend so baby owa no ne kwame na echo out one kwame a date for almost a year and a half hwe anya no we nya infection we nya sign bia I chese we or infection and answer bibi ntino bibi to chimano one kwame ejaye to one kwame ejaye no afi etwem ono kwampo onya be masem biem ntino we na dwen crave so sisi adem pese me focus na me hwe de nyame de me besi na me nya be ma papa bia obama brabo ma me ne no ebe look towards the future ewa aware kwan so nyame adom na maybe after a year or two na be ma papa bi aba be ma papa no kana obae no oni be ma nkoko hia ya ne first second sex pe oba na start so discharge ti o say abe me e na o ma me discharge ana wa start nya some irritation bi na ya start say ekeka no insufin bi start say egu no pampan bi start say den e ba ho tina why worried kaka say ana efi bema ya mekoko hia ne na ama nyama bi say e ba na bia na bema no so oyobi on so Felix on so no e clean kaka poni bi eni ho enso ko hia abesie besie na on so start say onya some reactions bi rashes bi start say egu ne bema ho pimples ba akubi start say ebo ne bema ho sisi odwun so a otimu ya okakra ntina oba no e wona dwum no see any boy or a player ntino mami advice me ho be me subeka say ana girl bibi nkoso a won kan kire me ana no nso advice no senka bia nkomutu no be hia no mabon komo aka say bibi say na me experience you but sometimes na adani to ka then opa che no pa che say me na mama infection ana wona ntukwamu na obia afa no kwan tina oba na adwin so ko treat no with the notion say be ma fufu okokonya yin na ama infection nenso na bia na kwame oni ni ja ye ago no infection bi odi ma no when treat no because na be a onko bema ho bia ho biem no anasa na ni white blood cells no were stronger enough they were one way or the other battling the condition no ema na dwimpo amma so say nsunsuansu bi sei e wo ho mame South na bema no so because ono so bi ana o feel say no you okay a problem bi ani wo no na onimpo say bibi sei ena e den ekoso on video mu nti okohia ne current relationship here na akọ trigger that old infection no amanaba tebasa na we baby say how will I know then that I have an infection? How will I know that I don't have an infection, especially in the women no? And then if I do, what am I supposed to do? And no come on and there baby bono and no come on here the term will put as complications and then what of an untreated sexually transmitted infections. You might be going through same condition. You might have a replica of what we are discussing. In terms of our relationship, we are forgetting because we think say we new partner in the mouth. And should be an entisa. How will you know as a lady? One, as we always say, there are some infections be a bar and monkaye. It is always best say we are bar now you're sexually active or more be ma na aye ntientia why are sabia amakwa kwhwe say den important na me ideally mpo if you go through such a complete condition and then you even end the relationship now it's advisable say nka obekọ na wakwa check say and when your infection be in the relationship now sometimes there are some variances, some bacterial infections, some viral infection. I take close to up to 6 months before they begin to manifest. Everyone say be a genital herpes B, people are HIV, people are hepatitis B, and yet right after sex no, and I started say manifesting. And yet malaria na about within 1 week. No one started saying say oh, a baby am nene crocodile na a manage dabi. Sometimes some infections take time to manifest. It takes time to show itself. And we always advise. That's why sometimes Dr. Deborah Bar will say anytime you are sexually active, at least we are bar within a year and scan there 3 times you also to meet. That is if you are sexually active. If you are not sexually active, at least once in a year there, also to meet. Bankofo Pina, they wait till they get to the state of being worry. Na fina no ho preno na fina no ho yen ntiatia wa yaresabia because our real neighbor. But one thing we want every lady watching today to have in mind, the moment you are sexually active no ma won 9 enye den ntiatia ewo ayaresabia na yehu anamo ayeso betumi etu ede aboa as an individual. Like I stated, the Rural National Health and Wellness Clinic Abeka La Paz and Afaonka, and we are doing this. Ye bon komo bi say, send also be to me a bibi. Now we want more also be to in case you go through such complications or in case you are finding yourself going through any of these conditions here. Ye baba bebo bosui. Now we want more about them. Also be to now why they we to now we treated that in complications. Men train now we do emra won to me enye hwe. Why? Okay. One, when you have complications now, say I'm kind of an untreated sexually transmitted infection can let you have one condition. I always say it, and it has always been on my mouth: pelvic inflammatory disease, PID. PID is an untreated gonorrhea or chlamydia that can progress to PID, which can sometimes cause a long-term abdominal pain, infertility, and then ectopic pregnancy. Pelvic inflammatory disease. Me sure say my baby. And sometimes people will send a WhatsApp. Then they'll tell you, doc, me go try a scan. Me go try a scan. No results ni new. You see PID, pelvic inflammatory disease. As such as saying, but we are bar. That's why we could try scan da. Now I catch you so pelvic inflammatory disease. It's just trying to tell you say the pelvic region. So you discuss it. PID several in internet. I'm sure say as I know my viewers, my regular viewers, you know what a PID is. The pelvic region, that is the fallopian tubes, the uterus, the ovaries, the cervix area. No, na bibi atouch my infection. This is an untreated gonorrhea or chlamydia. That's a bacterial infection. Can let you have a pelvic inflammatory disease. How will I know I have my gonorrhea and not treated? There are some people, omoko hospital now, na doctor catch them say, oh, we are in a chlamydia, we are in a gonorrhea. Numedrowe, unumria, ideally, it's a 14 days course. It's normally 2 weeks, maybe take now the numedron. Unumria, chlamydia, I always say this, gonorrhea, chlamydia, and then other conditions, no, they are not gotten by chance. It is through sex. Inti no only obi in a share na munya asa infection no. Inti unya asa infection na wo treat as oba no na asa 2 weeks no utwi wo fi be ma no nchen no. Enye magical say uba back to be ma no after that 2 weeks now. Oyare no ko. That is one thing you should have in mind. You should know say it takes time. Sometimes who obema no oba ni treat no bona bema no has been left and the obema is not treating himself. Njobanu takes time to treat Onono very well with the doctor, does everything that needs to be done with the doctor. Afe obewie no na wako back to the partner. Partner no on treating no ye. At this point, whilst the partner has not treated herself, no, what it means is that she is going back to the condition. She's going back to the complication again. She's going back to meet the same infection now. Or try to treat no. So Babu wants to treat chlamydia. O treat we no. That 2 weeks no because all funny doing to one corner partner and chain. O treat we no. Na the following week no partner naba. No na assign so e baby share bi. O share after 2-3 weeks no na assign so ababiem. Na afi you see oh I don't know doctor ne dem am na em say anye adwuma because me hu hwe. And some catch us a clinic we anya papa antisesa ko clinic fufro. No masesa no ko clinic fufro so with the same complication. Forgetting say nka all treating no na nka so friend a partner along they go together to get tested to get treated together. And no treat you whom we are after you be giving some immune boosters, we giving some antibiotics, we giving some medications to take. When we are you practice the abstinence for some time and then when you are both done, you go back to the health center. We've had countless of patients come to clinic. And when they come, sometimes they come with conditions. You try to treat the condition, and then I see sometimes there's a lady who came around that treaty complication. On the partner nearby, the partner be jan. So bejan a church derby. So one treaty there it's not always that best. One partner in treaty or like okay, anyway. And on any partner and started so much treaty a boom. In the process of treating, they were still having intercourse. But we don't do that. We should learn all these things as these are things we don't do. These are things we should take care of. These are things we should know. Say, whilst on the medication, you try to abstain. Whilst on the medication, you try to pull back, and then maybe after the medication, you can go back to whatever you want to do. So we should try to learn these things. Now, when you leave this thing untreated now, obabu onu me drone we na onso afele so me you okay me we na wa ignore no. Ti obekwa won say after a year or two no afi oko hospital na say oh madam oh PID o. PID me konya no he say last me call you see that's why we try to tell all our patients me treat me when we no come back to the health center. Let's find out say don't hear the man no. How are you faring? How are things going? Then we know what to do and then what? Try to help you. Another complications when it comes to untreated sexually transmitted infection is a chronic pelvic pain. And this one goes to a lot of ladies. You see, obabi wa ofele say wa na afi wayase na I say ewu kakra. Wa na I say wayase eyo ya sometimes it plays an echo escalate one afi utu echi unai utai so mu nyina na afi I say ohoni ya wo ya one medro one painkillers enko. It says untreated sexually transmitted infection can result in chronic pains within the pelvic region affecting the woman's quality of life. When the pains are there, sometimes the pains are so severe say and your baby sometimes on your menstrual cramps. And I always say these things to some ladies. We see ladies who come to clinic and when their menses are coming, they have free flow. There is nothing wrong with them. And in a compulsory say oba bia na bosome o mense say ba awose wote yaw. When you experience the pain and the pain is extremely severe, ema ntumi nya hwe na awose wotu ho anamo. Mentine fie. A lot of ladies think so, oh, menstrual pains, the end of babia, oh, menstrual pains, they say, oh, babia, bacho, and your babia, no menstrual pains. We should try and then learn this thing. There are some conditions that it makes the menstrual pains come. We have hormonal imbalances, we have infections like we are discussing, and we have other things like a pelvic inflammatory disease. To your bar, now, why wayase, na real kaka. Or na oti pains or wayase feel say before menses say ba nti ma otisa ana ataya mi share na ma ne ba sa ana coseti am boy na ma meti pelvic pains. Miss Ro, you are not supposed to be having extreme pains that could make you be on medication for a longer time. To your bar, na say you are going through such conditions now. Miss Ro, to an ammonia just said then and air coso. One thing we all know, I think, say in the month of February, we had this discussion. Untreated sexually transmitted infection as a lady can cause cervical cancer. And we know cervical cancer. We did the awareness some months ago, and then I think we made 1 or 2 in-depth discussions concerning the condition. So you should have that in mind. Now, when you have, and this is what brought about the discussion, and we brought Dr. Clement Apallon into our discussion. When you have this untreated sexually transmitted infection, it causes infertility. How? Sometimes when you have an infection, now when treat here, we've spoken about pelvic inflammatory disease, and we said it's a pelvic inflammatory disease. One of the major things that it causes is ectopic pregnancy. What is an ectopic pregnancy? Sometimes because of the way the fallopian tubes are inflamed, sekosuyano and egg ni meeting pona, they don't go to lie in the womb, they lie in the tubes. In the process, aklana asaya no, because where it is lying, it's not the best place. That is what we call the ectopic pregnancy. That is say nyinsen abana nyinsen amba ewa odie no nenso eba ewo odie ne chi. Oba bi wo onyemie na yefunu na sei, onyima na yefunu na sei, onyima na yefunu na sei. Or say be a problem in a so and I say sometimes like I always say na a spiritual condition na fi the ayem paiboni ade, and we believe so much in prayers. I always say, but when you are going through such complications now, find it out. Why you sabi a kucha scan? You interested then ne koso. And then I won't onyima na say, is there something that is going on? I had a chat with a patient this week. And she was saying, so, 1 year 3 times within this year. Nina say. And when I just say, oh, train kaka, next year now I started. The old train kaka, and we say, and I'm on Bena, which was so. Look, you say, young train. Until they say, I don't know, on mammy home. I laughed as a guy. Sometimes, yeah, you can see one train. But man, now one day, who can have a say, oh, you mistake. More training, mono. Or far baby na nipa nenyem ti why na dwen so beji akola no because wo dey na eba engina it happens all the time to your bar. That's why I say no a man baby now when you come to Royal, come and meet a lot of ladies there and you are wondering say there a man kwa na hwe ana dabi ya hwe mba ya hwe mema so but sometimes a man we leave ourselves so much because we are so much in love that we forget to take care of our health as well. We sacrifice so much for our partners that we forget to take care of ourselves as well. In the end, sometimes you feel bitter. Yeah, because you feel say many kwaku na ye bibia. Nta de na sisi akwaku ye me sa. Kwaku peba. Eba ne mbae no kwaku bisa no say anaye me ana. And with we as men, sometimes when we want to be certain, we might want to try elsewhere and say anaye me and I say mfi me. Oko na se won say mfi na. Why if you're too late more as well? So we always advise, we always advocate and say, oh, show me. Yambasi ebeton withdraw. And that's one thing I'm grateful to Home-Based TV. I'm grateful to Chairman Free. I'm grateful to the management of Home-Based TV. They give us the time to come and discuss conditions. We don't come and do. We have last month we had adverts. You see, we had patients, and when they send the pictures, they are like, "Hey doc, this is your baby. Oh. Hey doc, this is your baby. Oh doc, yeah, danyamiasio. Doc, minyimu." We did this June to July thing. Oh, praise be to God. Yankopon actually ni tumi ampa. The stories we are having, the pregnancies. Sometimes someone will call like, the money and magic, and I say, yeah, magical. Like, maybe me no me drone call me no way, and I need say naba. Because of injection near the mouth TV, so and a mobile injection near the mouth, labs need test near year, and I was so happy. We had about 4 people coming all the way from US, coming all the way from Canada to come and seek for fertility and then go back. I'm so happy. A couple that are living. When they give me like, "Doc, let us say, Yankopon show. Yeah, interestingly, they've done the artificial insemination twice, and they are not seeing results. And I'm about it is not magic. And then church will be see I am. When we started the conversation, you know, some couple even before marriage, no, they didn't do this HB electrophoresis, the blood groupings and all those things. Sometimes, no, you see, we pray your bomb pair, or sorry, not so for the catcher so. Oh no, blood test number and sana ya join in holy matrimonial. A sorry ni madentia or was small so test no. Who crumple when you girl nas one plano, uncle say also a beman who to sana mono now test no. Once a school for a job schooler or more test and sanya geno. Oh, quack for bad, datching. Only no, she is going to be the mother of your children. No, 1 year test bia. I saw no crumple take steps more paper so no. 1 koye. Oh, so now my worry. I saw no shira swamamo. My worry. 1 year, 2 year, 3 year. I womba. You are worried. Wow back. I womba. Mope second born. I womba. You are worried. Did you do those compatibility tests? Did you run those labs? You understand? When whilst we were giving on TV, no, people listened, people took steps. They came. Now say for that mountain. Even if you come now, you will never also ye. Your pani be also buama according to hormones no. Ama no hunka for no. Be as and first na kebeka so we dey hwe ni wa betumi ayo. Na say the abe for that mountain no. Bibi wo e betumi ayo. Utu ho anamo a yetumi ye ma opepepe. When to one or more, now, you know, sometimes people come. I had a chat with a patient who was talking about Abraham and then saying, oh, sometimes now they were able to give their maids to them and all those things. Now, Rahel into me, no, didn't made in a man, you know, and you can, Mr. We are all biblically good, but just have in mind, say, those old days prophets and things, no. That is not the kind. Me how no. Me kona sa hana minya. Maybe you honor metna. Me back. Enti oba no whilst you are sacrificing no. To one or more, find out what is going on with me as well. Brian Sabia, run a short and one is can be a point to amo. Ani people see us a mark clinic. Just come around. You wabu trewo. Benya me amount. You be shed the koso. You want a more serious than you two other boys an individual. I didn't see a ya. Bibi be fire more. Just come to Royal. Let's find out. Let's see what we can do to help you. And then in the end, no. You say Yankopo, a beshe no and yam. Ewo wabrabo. You betray your own aquacogi and war phone crato. Yaba. We're going to read some of the messages you've sent. We're just going to go further also to discuss 1 or 2 things we have. And then after the baby on my throne, so I'm also wafre. You try your own embraces here. Yamamu Akwa Baba Rural Natural Health and Wellness Clinic. Session Yamunim Rural Natural Health and Wellness Clinic has been in session for quite a number of years now. TMPC, am I a license? We are operating as an alternative medical center. So BBA, AOBA, say a woman, say a infection, say then a yo, say be a yaro. Na opese oba ayaresabia na ehwe no Rural Natural Health and Wellness Clinic your comprehensive lab e wa ha se bibia ye obi a doctor asio anase woko bebi mpuni aka chose Korane Medicals empo ebra na utumi ba Rural Natural Health and Wellness Clinic ya sio ha ebeba berane yo bibi sunkron ha your friend colon hydrotherapy se bia tete no na yesta esa anase tete ni se bibia wa aka chose obi a yen mix niama ni yemfa ensaw sa niama ni nyina ye won abefo kwan so Rural Natural Health and Wellness Clinic ha mo se bia wapon anase wakọ adwuma waye adwuma na wo ho hensha dan fe nye de bia na wo se bia wo se wo da edro so bi na nanka ohia massage kakra anase bia woni doctor bonko na se wo diet anase exercise bi mpo na o chiro na nka okọ mu a enka be den ebe ma wo ho acho no tumi agina wo ho na mu so biem na wo ho ayeden ne nyina no ba Rural Natural Health and Wellness Clinic ayo a doctor for her omo ne mo be bon komo be church okwan ya e wo se wo fa so nyame wo se wonye nyame wo se wonye se mo pe awompo na kwan ya wo se mo fa so na ma wo no ebebe mu se bia ye betwa scan se be oba anaso oba mampo ye be run scan actually say o prostate anaso say bibi mpo o testicle anaso bibi touch mampo even the abdominal scan bia na ya kire se kokoro ani bia na o kwa health insurance anampo say okwa korane test bi ni esi of scan kan no oba Rural Natural Health and Wellness Clinic a yitwa sa scan ni bi wa ha oba ye betumi adan etwa sa scan na ma ye wo health professionals wa ha omo akwadaro wo omodwuma omo ye ni mu ye wo pharmacy so a oba pharmacy ndru bi a ehuhia se wo se woto se bi a ya soma se brabeto anase wabampo na doctor na prescribe bi ama on ye ndru ni nyina no FDA ahwehwe mu a eye mapa a wotumi adan ekọ pharmacy ekokoto now ye den onom na oho eto bibia hia obi bibia ekire wadwum bia Rural Natural Health and Wellness Clinic no ye wo Abeka La Paz post office bibia ofi ba bia no fa car na catched mate ni say obesi wo Abeka post office udu Abeka post office a obo Rural Natural Health and Wellness Clinic ye signboard kes here green and white building mu just walk in then how only Rural Natural Health and Wellness Clinic and bonkomo Rural Natural Health and Wellness Clinic ye say wa pomoden ene wo hunya.
If you or someone you know are shopping for jewelry and accessories for a wedding or any occasion, make it special. Make it City Gold. City Gold is the leading gold hub in Ghana that makes special moments memorable just for you. Do you need genuine gold jewelry and accessory like earrings, watches, necklaces, bracelets, rings, and so on and so forth for that special someone or occasion? Do you need assistance in choosing the best wedding and engagement rings? City Bridal, under the auspices of City Gold, has everything that will complement your desired wedding gown. We have in stock all you need for your weddings, bridal showers, traditional marriage ceremonies, accessories, and lots more. Remember, our jewelries are specially designed to meet your budget and your taste. For wholesale and retail, call us now at City Gold 0302 906 750 or 0208 150 679 or locate us in Accra at the Makola Shopping Mall, 5th Gojo Thompson Road, right here in Accra. City Gold, home of quality jewelry.
We actually 4 years and so Emma Makwaba Kese Pamba Rural Health Talk Show. So before we went on break, we were discussing sexually transmitted complications that women have, and then if left untreated now could cause 1 or 2 complications. We're looking at complications such as pelvic inflammatory disease. As a lady, you could stand a chance of getting a pelvic inflammatory disease if you have an infection like chlamydia or gonorrhea, and then you left untreated, not could cause that. We also looked at infertility. That some sexually transmitted infections can cause the fallopian tubes to scar, or when we say scarring, because it's left untreated, it can cause the fallopian tube become very scarred, which means a baby cannot even be formed, or even if a baby is trying to be formed now, it could slip, causing miscarriage. We also looked at chronic pelvic pains. Chronic pelvic pains being pains that as a lady sometimes you go through. Sometimes we looked at dysmenorrhea. Dysmenorrhea has to do with pains you go through during menstruation. Now, one thing we always say that we assume that menstruation has to do with we should come with pains, but not everybody menstruates with pains. There are ladies who also have menstruations and then they do not feel any pain. We also looked at ectopic pregnancy, and we said when you're having a pelvic inflammatory disease, your chances of getting an ectopic pregnancy is very, 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 very assured. So if you are a lady watching us, and then you've once upon a time been diagnosed of a sexually transmitted infection before, if you're a lady watching us, or if you're a man watching and then maybe your partner has once upon a time had an infection, you could go back to the clinic to find out if the infection is fully treated or not. Because if these things are left untreated, these are some of the complications that you are going to experience. We have other complications like premature birth and then low birth weight. We are looking at neonatal infections. We are looking at increased susceptibility to HIV. That is, sometimes you become very suspicious or very suspected if you are somebody constantly having a sexually transmitted infections. Obviously, people would want to know, or your partner would want to know, say, what is really the problem? And then might draw men away from you if you're a lady. It might draw ladies away from you if you're a guy as well. Because infections you understand, the person might not want to continue a relationship with such an individual, and might even inform the friends as well. So I dated this guy and this is what I experienced. If the second person go, me too, I dated him and I experienced the same thing, just know as a person that, as a guy that, or as a person that such complications would not draw men to you as well, or will not even draw women to you. And then we have the genital sores, and then genital herpes, and then genital ulcer. I think we have to discuss that a little, and so we will dive deeper into it before we go into the men. So let us quickly talk about the genital herpes, genital sore. Sometimes we call it a cold sore. You understand? Yeah. And no say eba we ignorantly say oh where the cocoa, oh where the cocoa, a man especially wanna adena ba as a dot. Now sorry to say a C around your service area. When say na adena ba kaka ba ko na ama ho na ayedin. Oh o feel so where cocoa ebeko, oh where the ebeko wona afi na it keeps escalating. Now fina afi eba as an waiting na baba bedani crew. Tibeda ni kro no eja na wa penku bi ana wa pesrade bi na de afra so okwa kotuto cream si ai tuto bi na de afra so wo de cotton abom na de afra so thinking say ebeko wona enu a wa na ahye to feel so we okay to na san so ababiem ave this time buy na mba mienu eba miensa wona spread towards the eton kwan no so na eko things so we there normal koko bona afi abeda ni kro na abeda ni scar na afi oho a da ho bonsa afi ababy bona the hang around the skin. You might think so we dey anyehwe ni nyina no, there are infections that happens to ladies. There are complications. Infection be a ya o felice o we dey eno abe continue nja ne sa no eno na dey akofa sa aba ne to your ba. That's all wana bibi blisters be, we call it blisters. Once na oho na ho kaka isa sheshe nsu kaka o wa ya se o ties ni ade na me pa cho ehun be hia se obetu ho anamo. Mo hwe se den na ekosisa infection na ma ne ba ne sa ana say bibi fufo mpo na ma ne sa. Is it a skin disease ana? Let us find out what is wrong with you. This a home here say bepe dermatologist amawa. Ye besa. If a home here say bepe ye no only guy in the bekasa. You do that. So home here so say yeah be sure you try to make sure you are okay. Men konko to do be enfants rasha thinking so and no abeko a bit treaty. Well, if you born baby go I want you not be confident to go closer to even a man. To your bar, and I say, oh, go through such conditions now. Yes, so to an amount, says in a mechanic. I'm sure say you watch the break, you know, your co break movie, run a show and one is like, you have a very nice edifice. We have a very nice facility. You could just make your way there. Let us see what is going on with you. Let us see what is wrong with you. And then let's see what we can do to help you. Maintain if you're thinking so, Okwako talk a doobie. Once a what to do be where you say, acquire naba, we say, you know, I met some patients like, Joe, do you know what? I want to pause. I want to see what is happening to me. Oh, then they come in like, hey, Joe, when I said I want it to happen to me right now, it's becoming worse off. And any sometimes you realize I always tell some of my patients knows it. Ubana Mikacho say, oh, my main referral amount, you should know say you are getting to a stage where we can't do anything for you. Men China won't do. We do now. Sometimes when we are referring you, hey and yeah. But we try, we have to. You understand? We are individuals and we also are emotionally, sometimes we feel emotional when we come to meet conditions like that. Do your bar. You see, that's why I always say it. About the sana, you know, sometimes when a statement, you when so Barbie say, Bema nebu no kwasia, Bema be embu kwasia. And can also to an amount because with men like I'm saying, meaning say oh your bar now when you're an untreated sexually transmitted infection. Now one nothing na maba na me no baba be start here babo. Now for me say these are some of the complications you have in you. I might not be confident enough to even work with you. You might have all the good characters, you might have everything. But say me say oh that channel me no a ban chances of childbearing a problem now. I might want to advise myself. And I'm sure that applies to a lot of men. We would want the best for you. You're no beba clinic. You're better to be okay. You're sure you do be me say you to me here now. Yeah, that is when we are being forced to look elsewhere. To know your bar, measure say to an amount. My young who the echo I you who the eyes will be to me hiding. I quickly let's open the 0501484671 0501484671. At this point, the BB also over to me afraid not why then we'll be so whilst we quickly try to read some of the complications in men as well, and then we try to read the messages you send whilst we wrap up. With men, one major thing that we always see when it comes to complications now, and it happens to a lot of men. We normally don't know what is happening to our sperms when it starts like that. So we are not really perturbed about it. Until we get to a state that we are now over worry, and our worry opa war, now we are not a woman. Now we're checking and see your sperms no and your papa. If I say ban send sperms in your papa, I got to say be an infection be a unya no. Our sperms now won't din in our form. And now put our sperms now won't din in hiding. Sperms and quabone or that away sperms dance and we have a caller online. Hello, good evening, Pacho. We didn't be our free. Good evening, Pacho.
Pacho, good you begin to say, Oba, people say, and a capable.
I just go no idea.
You will be
okay. Okay. Right, but Fatosuna, we will project our number after the show. No way to me, Afrina. What can say person administrator Nekasa? I'm sure he would have time to discuss with you in terms of treatment. Make sure you see, and this one thing we also advise our patients. We are natural health and wellness clinic, and you are born shada and yedinsa. Your hospital into Uba no only doctor tnas na you condition na. Obi o access in your okay. We are no wenya go no na wenya no. Echo deeper no, and year 1 week treatment in a deep treaty. So what I say, we are now also they do so for some particular number of weeks. Like I said, sometimes it takes 14 days. So 14 days, no may do no so. Name why you should abstain from. And then also, hello.
Good evening.
Good evening, but you didn't baby of faith.
The catastrophe.
Okay, but you eat you.
The battle. Maybe Percy.
Okay, question, but you eat you.
Now, so many, my worry, say, and I'm many, echo have 6. First day, second day, by all right. Actually, a medium. It's a battle, Commissioner Buamia.
Okay. All right. If I also wait me the phone now to Suna with me, I would love to be answering as well. Okay. So it says in your can maybe let me just read something to give to Kwesi so that at least we can continue with our conversation. Erectile dysfunction says some sexually transmitted infections like chlamydia and gonorrhea can lead to scarring and inflammation affecting sexual functions. Sometimes, says in your kind, first, second day, and so subsequently, never be now touch my hello, but good evening, we didn't be our faith.
Hello.
But you're at you.
The church.
Okay, George, it's you.
Now, the symptoms at the time of the
Okay. All right. But also, Fatus will quickly explain, do that for you. Okay. Just to end, our colleagues, that's the one, not the first, second day, on any partner share, I dare no into me, Ember Beam. Next show, there could be an infection. There could be a problem. It's not mechanical. Your time na bra. Sometimes we Johnson penny be genia share. And when you say bedroom moja, bedroom Johnson near shame. Yashe Johnson no more. Bibi I touch maybe an ibe near day. You know abon commoni who dey bet me aye as a health center at the abo. I'm happy saying the member pa. The other gentleman also asked about gono, the signs and symptoms. So sometimes the gonorrhea no. You see, I always say this thing. Obi feel say oh. Oni so to so any partner ni share we now adichie na okọ na odwunso na no start a year won junso no we are bema we also experience pelvic pain sometimes so yeah mema sometimes ya yase etaye ya we are bema sometimes we feel say o balls o scrotums ni mu no ye fre bi orchitis we bon say na balls mienu ba kwa ye kese extremely seeing the other. These are signs we mo bon kokko say there is a problem. Obebe bo I don't know office na afio na obi ni trousers mu then there I have one slogan most of my friends say you be treat I don't need to mention names but one almost kokoji their names there are several names for the alcohol. Mommy way mommy say they mention the names of the alcohol and then they drink it thinking so you treat you put infection one mommy 4 thought mommy 3 thought and you need to treat infections. And you need to treat infections. So we treat infections. We use antibiotics in treating infections. I have never. Bitters na na mama muni papa no motete no mo treat infection no. Na ensa enim. And we shouldn't have that choice say oh yeah bitters and you treat infections. Make sure when you infection and your infections ni nyinara and na efin them. Infections be what if you baby if in the washroom you use it. You understand? Infection do what? A man especially. Your boxers near trousers, your panties near them. We hardly wear them. We hardly remove them. I know of a guy. Those times the whole school no boxers no. Your cover or you need jeans trousers in the same one. Boxers na no share. And or the other. Adichia okudra no you boxers in the same hole. Oba back no. One share boxers. Me think face will be because your doors room into no. Be best some boxers no na. Or the towel base and won't share the same jeans near Gusunapa or the co. Understand? It's such a person, after some years, when the person come back and complains, oh, I wore who are problematic and answer there. And your infection, Okunya, I want them. The boxes, no, jeans, no, who are jeans, no choice, oh, black jeans, they say in you, and I see a poo near the aqua sign, you're the best fridge. It's sure infections near build woman. You might have no idea about it. You have no idea about it. You understand? And when it happens that way now, you push it blame ni na ato emma no so na emma ne na ebe ni baby. Hello, good evening. But you baby offering.
Good evening.
Good evening.
Me touch for me this easy. The program me touch one na me work.
Mba cho yeti o.
Me touch me that's for me command say what if you do have.
Mba cho da be facility ni be ni Kumasi, but after show no betumi afre na only administrator akasa Dr. Clement oba Kumasi wuku adantino. You could make an arrangement with him and then he will come and attend to you. After the show, no free numbers, numbers will be projected now by my producer. You can pick any of the numbers. For numbers, need enough free now. Unsure how to go about it if you are in Kumasi. Why? Okay. All right. We need to quickly wrap up. Remember, sexually transmitted infections when they come. Mr. Yentu anamo. My jam man and with women, our complications are such that sometimes we might not have an idea of what might be going on. You understand? Yet the is when it get to the latent state now, until then you might not be experiencing any of those signs and symptoms. It is advisable say, like Dr. Deborah always says, "Oh, your bear man, that's all your bar. Now you are sexually active. At least every 3 months, be an say, and then at least have an idea of what is happening to you. It is best that way. It is best that way. At least it gives you an idea, especially with the men. Because you realize, oh, this is good. I'm ready to go for this thing. Now, quite unfortunate, a warning to me, I amber. Your question is who spends in our say. It's going to be very worrisome. To know what I will shame make sure so you obey to anamo kasepa. As that I send the entire crew that helped me, and as that I send to you, Sugar Bread, Gideon. I want to mention Sugar Bread's real name, but he always gives me some funny names anyway. And then to the entire Royal Natural Health and Wellness crew, today you people did well. We started the breast cancer awareness and the team was on point. Also, we share Royal Natural Health and Wellness clinic this month of October. We are doing the breast cancer awareness. And you can also come around. You're interested then also. Just let us know every complication. Regina, Abigail, Dr. Deborah, the entire crew. You were so wonderful today. Yankopon Enshiramo. And there, Madame Fupan Ali, and there, your birthday, Yankopon Enkoso and share. You've been a great friend, He's been helping me with fitness, and then I'm very grateful to Ali. Today is your birthday, Yankopon Enkoso and there. Ensure as that can say Koma Irene and Dra na your birthday and as that can say from myself and then your husband and come out Yankopon Enkosua Ensure with whatever you are doing for us as a clinic and then for me as Joel. I'm very grateful. As that can say Koma the entire crew as well, like I said earlier on, that helped me, and then also to New Casual for my outfit and bless Yankopon Ensure that's a ne be share a bebon komodia mejiso Joel Aidaniso Macron.
Home Base TV, total enjoyment.